Next, I'd like to introduce Kanchan Ganda, professor at the Tufts School of Dental Medicine, who will introduce nominee Jaskaren Randhawa.
Good morning, everyone, and good morning, President Monaco. Thank you so much for this award, this special day, which highlights our students who do so much for the community. And it is an honor indeed to nominate one of our students, Jaskaren Randhawa, and JK to all of us. JK and I came to know each other 4 years ago when I was starting the first-year medicine program for our students. And in addition to learning the amount of medicine, the students also get exposed to treating patients who are victims of domestic violence, HIV patients, and patients with developmental disabilities. And as soon as the lecture on domestic, I had Jaskaren and JK come to me and say, Dr. Ganda, I would like to get involved with helping you with whatever lies in helping these patients. Long and short of it is, I came to know that JK had a public health background, and she was very interested in not only helping victims of domestic violence, but she also wanted to help any other patient in need of her help, her services, in whatever way she could contribute. That is how our relationship began. We have a huge domestic violence program at the dental school. She not only spearheaded in publicizing the program, but also helped with coordinating the care of these patients as they came to the clinic. She got involved with the HIV program that we have at Tufts. We've had it since 1991. Which provides for the free care of these patients, dental services. And she worked with me as the faculty mentor to look at the oral lesions in these patients and actually presented the lesions that were encountered in these populations and won the OKU award last year. She then started discussing with me the LOTUS program. LOTUS program, LOTUS, that stands for Linking of Tufts University Students, was something that came to mind in August of 2012, where I felt that wouldn't it be nice to bring all the student body together, medical, dental, nutrition students together, so that they could all work together towards the betterment of the underserved population. As a faculty advisor for the South Asian Medical and Dental Student Organization, I put this idea forward to the small student body that I had with me at that time. And of course, JK, my ever-ready Energizer bunny, was there saying that I'm going to take on this project and I will be the leader who will help you make this a reality. So that's how we started in August of 2012. And the idea was that we would go to Castle Square Projects, which is an underserved patient population project in Chinatown. And it houses 1,500 members, 500 families. And we were going to start a program there that would offer medical, dental, and nutrition services to all the underserved patients that live there. And in addition, we would also mentor the children so that they would get exposed to the sciences. And who but JK was the one who spearheaded not only the leadership, but also the coordination of the entire student body that came forward and participated in this volunteer program. JK organized the student body into small groups where they put forward a portfolio that we presented to Castle Square, which outlined what our intent was when we came in to serve the population there, what we were going to be doing as far as dentistry, medicine, and nutrition was concerned, that we were going to work through this entire program in 3 phases. The first phase would be we would conduct the screenings of the population. The second phase would be where we would do some kind of minor treatments for these individuals. And the third phase would be where perhaps with appropriate funding, we could set up a permanent place where these individuals could come and get medical, dental, and nutritional services. We put together the portfolio that was presented in March of 2013 that was accepted by the Castle Square board. And soon after that, I had a massive brain hemorrhage and a year ago. And as soon as I came out of that fiasco, my thoughts went to what's going to happen to the Lotus Project. It was JK who sent a message to me saying, it's going to go on. And that's what she did. With her leadership and with all the student body behind her, she rallied all of them together. They created a protocol that would implement the first screening project. In the first screening project, we screened 50 patients for medical, dental, and nutritional needs. She is the one who spearheaded in creating the health forms for these patients, not only in English, but also in Mandarin and Cantonese. And how did she do that? She got our Chinese student body together and said to them, you have to take these medical forms that we have and you have to translate them so that we can have the population who does not understand English to know what questions they're being asked so that they can answer those questions. She also wanted the non-Chinese speaking student body to understand the Chinese culture. So she organized a segment of the student body who would educate the others about the Chinese culture. What she discovered was that there were some students who were born and brought up here and did not know much about their own culture. So she pushed them to talk to their parents and their grandparents and come up with ideas on what are the norms with the Chinese society that everyone should get to know about. That is how she created cultural awareness. Of course, we've had faculty mentors that have gone along with all the students that have been working on this major project. But in addition to running the first screening in May of last year, there was a second screening that was conducted in July of last year. And that screening, we saw another 50 patients. I returned to school in September of last year. And then in October of last year, we conducted the third screening project, where we saw 115 patients, adults and children. And in all the data that we have collected, we are going to be evaluating the outcomes of all the information that we have collected. She wasn't just satisfied with that itself. She worked with one of the faculty in my division and applied for a grant. And we have a small grant that is now going to be utilized to do phase 2 of this project, which is we're going to be doing the dental hygiene on these patients, and we're going to be conducting minor fillings on these patients, and we're going to conduct focus groups. So the idea is that this program is going to move forward. And JK knew what I was thinking when she one day sat chatting with me about this program, and she said, don't you worry, Dr. Ganda, I am not going anywhere. Even though I am going to Columbia University to run, or rather to participate in the general practice residency program, I will be back. And I will do something similar at Columbia University, and I have no doubts this is one dynamic person who has so many facets, so many areas that she brings together in order to do something so successful and so beautifully. She is humble, she is ever smiling, and she is very productive. So it gives me great pleasure in nominating her and an honor in calling her forward to accept this award.